And we're live with another episode of Peptides and Age Management with Dr. Kris Wusterhausen. Dr. Kris, how are you today?
I'm good. How are you today, Steve?
I'm excellent. So glad to have you back. And I'm excited to talk about today's show. As we go through life, one of the things that we worry about as we start to age is what are the things that we can control to take better care of our health. And I was shocked the other day to learn how muscle tone or muscle mass is a big impact into how you're going to age. And it's something that I really don't think about, but the better your shape of your muscles, the better it is as you age. And so today's topic is aging your muscles and peptides. So, Dr. Kris, again, the conversations that we have, these are you're the voice for peptides. You're helping us have conversations with our providers, and you're helping providers have better conversations with their patients. So the topics that we cover are for consulting and educational purposes to help us be better equipped to take more control of our health with our providers. So what's going on when we age in our muscles? Why do we lose muscle mass, and why is it so important?
Well, it's a multifaceted question, and it's funny you kind of bring that question up because I had this conversation with a patient just yesterday who's 60 years old and is starting to lose muscle mass. And that process of it's called sarcopenia, where you lose your muscle mass and become frail as you age. And the main thing I tell patients is that we have to make sure that as we enter our 50s and early 60s, that we've added enough muscle mass, so that we've stored enough muscle mass. Think of it like a squirrel with their acorns, that we've stored enough that we can get through the last stage of our life without hopefully it becoming too big of an issue. And we're for quite a few years in our life, we're anabolic. We're adding things, we're gaining muscle mass. But then unfortunately, as we start to get a little bit older, as hormones start to deplete, peptides start to deplete, activity many times as we get older, most of us are not becoming more active as we get older, we're getting less active. All these things work in a circular pattern to basically start losing our muscle mass. And muscle and bone, it's the two biggest things that I tell my patients that we have to be very, very careful of as we age, because we need enough muscle mass so that we can stay active, be healthy. God forbid we trip over the garden hose and fall down our front yard. We don't break something, but also at the same time, keeping those bones strong. So especially for the ladies, so that they don't become, I always say, that little hunchbacked little lady, because our grandmothers didn't really know they just didn't know what to do. And they've always been told, just make sure you got enough calcium in your diet, which it's really, in my opinion, more of a vitamin D issue than it's a calcium issue. But luckily now the generation that's our age and younger, we should start seeing less of osteoporosis and osteopenia if we all kind of follow these basic guidelines that our patients are doing. And so, it comes back to, and I know we'll cover it more in depth, but it's the basics, as we always talk about: eating right. And my God, that exercise. Like I tell my patients, exercise has always been associated, and I even did this for a long time, with losing weight. We exercise to lose weight. We really don't exercise to lose weight. We exercise to stay healthy, keep our heart health, build muscle, keep our ligaments and tendons strong. The whole fat burning thing is much more, in my opinion, about hormones and nutrition. But that's why we exercise and resistance train. That's why all of us should have some form of resistance training if we can tolerate it in our exercise routines.
So what's going on when if we focus on exercise in a way that we want to improve our muscle mass, does that mean we want our muscles to get big, or do we want them toned? What's the right perspective to have about that?
Totally just depends on the person. Like in my office, we have a bioimpedance scale that we can actually measure a person and, accurately know what their muscle mass is, what their body fat is, what their water weight is. And we can look at those if a person, many times you'll see the guy that comes in that has the big pot belly, but when you look at his muscle mass, he's got plenty of muscle. I mean, that's not the issue. He's got too much fat. But so we don't necessarily need that gentleman to gain muscle. We need him to tone and to lose fat. And so it's really just it just depends on the person. And so that's where I try to tell my providers that they should all have some sort of scale that can actually test muscle mass. Because like I tell my patients, I really don't care what you weigh, unless you're 5'6", 220. I really don't care what you weigh. It's what's your body fat percentage, what's your muscle mass, what's your water weight. And so when patients call in and say, I've gained weight or lost weight, it's like, well, you need to come get on the scale because I need to know what we've lost, what we've gained, where we're going with this. So, most of us all need to tone. So I always say that's a definite for all of us. And then some of us need to gain some muscle. We're not talking about Arnold Schwarzenegger muscle here. So, we're talking about for most people, for most ladies, I would say the muscle mass issue is much more of a female issue than it is a male issue. And, most of the time I'm talking about trying to gain 3 to 7 pounds of muscle, not tremendous amounts, but that 5 pounds of muscle can make a tremendous difference in their longevity.
Well, what's going on when your muscle just doesn't sit there? There's some more comprehensive effects when you're increasing the tone or the health of the muscle, correct?
Yeah, well, you're helping everything. Your overall health improves as your muscle mass improves, your cellular communication improves. As we talk about, it decreases joint pains and muscle aches and things of that nature because as you're more toned and strong, your joints just don't typically hurt as much. So osteoarthritic, one of the big things we always tell our arthritics is to exercise, get active, get moving. Being inactive, we're meant to be active creatures. We're not meant to be, sedentary. And that's one of the big issues of our society today is that we all have become, not all of us, but many of us have become quite sedentary. I used to say the reason why our forefathers could eat not so great and get away with it is because, they were out there behind a mule, plowing a field all day long, burning everything off. I don't know about everybody listening, but I certainly don't do that. I'm sitting most of the day and so that's why we have to mix in these different exercise routines.
And so if you're out there behind the mule or if you were hunting, that you're naturally doing a version of intermittent fasting, because you're not sitting around snacking, but you're active and toning that muscle. You may not be getting really big, but I don't think that's really what you need.
No, getting big is not like when I talk to my patients, and it's something I've told you that I've started doing my patients, like, what's your goal? And like, I'll have some people say, well, if I do this, this, and this, I'm not going to get huge, am I? And I'm like, that takes a lot of work to get huge. That takes a lot of genetics. Sometimes it takes some other things, but that's typically not going to happen. Again, we're talking about small changes in muscle mass, maybe improving by 3 to 5%. We're not talking about huge gains here for most of us. I always use myself as an example. When I'm 48 now, I'd say about mid 30s, I was about 155 pounds. And I'm a little heavier than I should because I blame it on COVID. I'm about 180 right now, but I couldn't gain that weight to save my life. Every time I gained weight, it was fat. It was not muscle. And it really took me to learn how to properly train. So many patients exercise, but they don't exercise properly. And that's where I think a good trainer is worth their weight in gold. Even if you just went and found a trainer for maybe 3 months to get you going, teach you how to do things, or sometimes now you can get trainers that oversee, will give you a week or two's worth of workouts. and oversee your workouts. But improper training is one of the biggest mistakes that I see with patients. With this, I always tell my patients, if anybody's ever gone to the gym for a consistent amount of time, you've always seen, I'm just going to say Pete over there on the treadmill every time you go in, doing the same exact speed, the same exact height, for the same exact length of time every time you're in there. And Pete never looks any different. And it's because Pete isn't really working out, because, you have to keep the body, you have to keep the workouts changing. You need to have a very good mixture of workouts combined with, like Maury's been on our show before and talked about, we prefer like the full body resistance training 3 to 4 times a week. But it's all about flexibility. It's about muscle mass. It's not about getting huge. As we joke, I'm way past that at my age at 48. I'm reasonably strong, but I'm not trying to lift with the 20-something-year-olds. That's how us old guys hurt ourselves. But we also want to train properly.
I grew up training in high school for football and stuff, but what I realized is the aging is that the way that I defaulted as far as my thinking of training wasn't relevant for that stage of my life. And so I had to change my expectations of the workouts. And the other day I was watching a video on isometrics, and it seems so counterintuitive, but it's amazing the increase in strength that you can have by just doing isometric exercises.
Yeah, sure. I mean, it goes back to that. I mean, we've all heard it, but it's especially for men, it's hard to remember. We don't have to lift heavy. You can lift, actually my brother's early 60s, and I kept warning him. He's really strong for his age, but he just wanted to lift heavy, and it's like, you don't have to lift heavy to get the same results. You can just simply do more reps. And like Maury, like we've had on this show, he's the one that's really taught me, you don't even need machines and things like that. I mean, like you said, your own body weight can do amazing things just if you just do it in the right way.
So what are some of the suggestions? First of all, let's start with the free ones, the things that we can do maybe in our house. Maybe we don't have a gym membership. What are some things that we can consider to start improving our muscle tone?
Yeah, well, the first thing is going back to diet, because it's always so important, and I know we hammer it all the time, but when it comes to longevity, wellness, muscles, just our overall health, it goes back to intermittent fasting, and that's just I don't want that ever to get forgotten about how important intermittent fasting is. How much of a positive effect that it has on the body. Again, just for patients or anyone viewing that doesn't know what my definition of that is, that's 16 continuous hours while you sleep counts of no calorie intake except for water, black coffee, or unsweet tea. And that can have a profound effect on your immunity, your metabolic rate, just overall how you feel, think, and your energy levels. And then nutritionally, really, in my opinion, for most of us, if we can try to stay on that more low carbohydrate, good fats, moderate, protein, high good fat type of a diet, not necessarily a ketogenic diet, but that's going to really help as well. And then, of course, we move into exercise. That can just be as simple as getting some bands, from Academy or wherever you're at. And, there's tons of just exercises that you can find all over the internet with bands. I think you can get a set of bands for like $10, $15. And again, using bands and your body weight, heck, a push-up is a great exercise to do for toning. Your own body weight, just with that, sit-ups, crunches, squats, just with your own weight. I mean, that's what people don't understand is you can do a few more that way, but you can get really, really good results with that. And then you can find things around the house. You don't have to go buy a weight set or anything like that. There's, some ingenious workouts you can find if you YouTube this kind of stuff. But the biggest issue with doing it at home that I have is just, are you going to do it? Me personally, no, I'm not going to do it. If I'm going to do anything at my house, it's going to be out working on something. I'm going to use that time to go, because we live on a little bit of acreage, of going to mess with things. And I'm getting some exercise when I'm getting some resistance training when I'm doing that. I shouldn't use the word exercise. But if patients are motivated, mix in a good walk around the block, get the heart rate up. That's some good cardio. Try to do that for 20 to 30 minutes, and then mix in some simple isometric type exercises, as you talked about, around the house. Maybe mix in some band exercises. It's really easy to do and very, very inexpensive.
So, one of the things that we talked about, that really as we age, we lose our appetite and we start to not sleep as well. And yet toning your muscles and doing just a little bit of this can have a big impact on this.
Yeah, and that's actually a great point. Because you probably know, as well as a lot of my patients do, that I also have a very large long-term care practice with with hundreds of senior patients that I take care of, and loss of appetite is such a big deal. Like at my age, I always go, that'll never happen to me. Loss of appetite, heck, I fight too much appetite, but it really, inactivity and aging leads to loss of appetite. And then what happens as we don't eat? Well, we lose all those nutrients that we're supposed to have. We become vitamin deficient. Vitamin deficiency, hormone depletion. We start running into calcium issues, loss of bone, sarcopenia, the loss of muscle mass. And as all those things start to kick in and we're inactive, then we become more inactive because we don't feel good. We don't have enough energy stored to actually do anything. And before you know it, over however long, 5, 8, 10 years, you become chair bound. And then before you know it, you're bed bound, and then it's over. And so, one of the things I tell all of my seniors as I'm seeing them who are still active is that inactivity leads to death. We are dying faster if we're inactive. And the more inactive we become, the more rapidly we're dying. I don't think that's debatable. And anyone that and that's what I tell my patients who don't know where to start. Just get out and start walking. Start there. I mean, do something. Do anything. Walk the dog. Just get up out of the chair and get moving, and try to do a little more each day than you did the day before. And if you do that for 6 months, you'll end up somewhere good.
It helps you mentally as well.
And then I'm sorry to interrupt, but the sleep, that's a huge one as well, because you're absolutely right. I talked about the loss of bone and muscle mass and all, from the vitamin depletion and all that sort of thing. But yeah, we start to really have issues with sleep, and sleep and activity are so crucial to feeling good. And I think you and I've had this conversation before, but you get one bad night's sleep and it at our age, at least for me, it practically wrecks your next day. And if you could only imagine if you have poor sleep every night, just, and then what happens when they get poor sleep when you're aging? Then they start napping during the day. Well, guess what that does? That makes your sleep at night worse. And you get in these loops and you can't seem to get out of them. And so, that's a great point about sleep.
So one of the things that really is a common theme through every single one of these conversations is that everything goes back to the cellular level. The way our cells communicate, if we can get them to communicate better, then all those billions of cells that are in us start to heal us and help us understand. And one of the things that really convinced me to be more committed to doing this was understanding the connection between exercise and your cellular communication. What does it do? What's going on?
So let's revisit the topic first, in case anyone hasn't heard it before. But I go back to actually my daughter. Yeah, it's my daughter. She's a freshman in high school, and in science class, she's been bringing home all these things about the cell. And it's just been kind of funny that, I always say it's biology 101. I mean, we're not high level thinking here when it goes to cells and what we're trying to say here. And we're made up of just tremendous amounts of cells, billions, of cells. And at the end of the day, cells are what makes our energy. It's what fuels our immune system. It fuels every system in our body. And if a cell can simply communicate better and do its performance better, ultimately, it's not too hard to understand how we start to do better, feel better, and have less chronic disease. And so that's the basis of everything. And it doesn't matter, I think we unfortunately had to skip last week. So I think it was 2 weeks ago that we talked about the brain and how, I went to the conference and discussed with other great minds in the peptide field. And really it's kind of eye-opening that it doesn't matter what system we're talking about. The science is the same, trying to get the cells performing better and communicating better. And if we do, we get better outcomes. So if we have better cellular function and we are exercising properly, we're eating better. And I'm sure we'll mix in some peptide talk here in a second. We're just giving our muscles the ability to do their job properly, to be able to maybe not even if we're not gaining muscle mass, but maintain that muscle mass longer. It just ultimately is that effect that we just end up healthier. That quality of life aspect remains good.
I love these conversations because it's addressing a different perspective on medication and health. And when we can start to help our cells communicate better, then we can skip past traditional viewpoints of having to take a pill every day or only having the options of whatever is over the counter at the pharmacy. And so when we talk about peptides and what it does as far as your muscle growth or your muscle mass, peptides are, again, they're naturally occurring in the body. These are bioidentical formulations of what your body already makes, but it's basically they're signaling tools. They're telling your cells how to communicate to each other to heal itself. Am I off?
Well, so no, there are some peptides that are not natural, but for the most part, many of them are. And we use, like I saw, I'm sure it was Dr. Seeds that posted it, but I'm in a forum with a lot of other peptide physicians that are within our training. And the post was not only is it important for a provider to know about peptides, and it's also really important to know when to use each particular peptide. And so the cool thing about peptides is that, you can pick certain peptides that really are geared towards fixing whatever is truly the problem and amplifying that and letting the body truly heal itself. I think ultimately that's what physicians signed up to be, as healers of the body, where most of us for most of our career really aren't healers per se. Oh, I mean, don't get me wrong. We heal infections and things of that nature, but so much of what we do is just chronic disease and reactive medicine is what I always say. Okay, Steve, you've got high blood pressure now. Here's your high blood pressure medicine. Well, okay, give the high blood pressure medicine, but maybe let's go back and look at, why does Steve have high blood pressure? Did you just get it because he's older? Is it because he's overweight? What's going on there? Or my favorite, diabetes. Oh, you're diabetic, Steve. So here's your diabetic medicine. Well, okay, that's fine. I agree. Let's treat it, but let's go back and see what we can change to possibly cure that type 2 diabetes. I always tell patients when I diagnose them with these like insulin resistance or diabetes, when I went into medicine, the first line of defense for diabetes was nutrition and exercise. They've completely wiped that out of the treatment protocol now. It's no longer there. And the reason why is everybody gave up on it. They're like, well, no one wants to exercise. No one wants to eat right. So screw it, basically. Let's just jump to pills or shots. And I think that's a real disservice, because my patients actually, for the most part, will eat better and will exercise if you give them a reason to do it. And so that's just, and so then that's where we can then start. Once like I had this discussion with a patient yesterday about peptides, and I was like, and this patient has in the past been very active with exercise and has eaten really well, but COVID has really taken her and her husband off track. Like a lot of people have. I always say COVID's really swung people either to getting healthier or really kind of getting off the complete path. And so I said, okay, but before we go down the path of peptides, let's shore up eating better. Let's get hormones right. Let's get exercise proper. Then we can start mixing in the peptides, because if we're not going to do A, B, and C, exercise, diet, and hormone balancing, if they're hormonally imbalanced, I really think that the positive effects of peptides are somewhat limited. Not that they won't help, they will. But I personally believe that we have to do those first three. And if they won't show me enough motivation to do those first three things, I'm not quite so sure that they're going to stick with peptides anyway. And really, at the end of the day, we might be all spinning our wheels at that point.
Yeah, I think the people that listen to this podcast and these episodes, they're more proactive. They want to know what they can control. They want to take more ownership in their health. And so that's why these conversations are really fascinating and helpful for me. So what are some of the peptides that this audience would want to consider to help them, I guess, heal faster, or to get a better growth of their muscle mass?
So the good news is many of these peptides are multifaceted, and they do, each person that comes to me that's looking for peptide therapy, and we agree together that they are a good candidate for peptide therapy, have their own reasons for doing such. But the good news is many times these peptides cover wide-ranging positive benefits. And so, again, I've said it over and over, my favorite, probably my workhorse of all non-over-the-counter peptides is CJC ipamorelin, working on the anterior pituitary, causing the anterior pituitary to produce and release more growth hormone. Again, as I try to make sure my patients understand, it is not a growth hormone. It is not growth hormone. There's some differences there. Growth hormone, for any providers listening, is really pretty hard to legally prescribe. With all of the athletic issues that we've had with illegal use of growth hormone, the FDA's it's very hard to legally write growth hormone. And on top of that, it's really, really expensive. I mean, most of the time, a script of growth hormone per month can be $600 to $800 a month cost. In addition to that, there can be some real negatives of pure growth hormone, such as if you're making okay production of growth hormone, you take growth hormone for an extended period of time, you can suppress your own growth hormone production. Insulin resistance can be associated with growth hormone. There's more carpal tunnel associated with growth hormone. Some people think that maybe even tumor growth can increase with growth hormone. But at the end of the day, I tell my patients cost and the inability for me to really legally write it are the big reasons I don't like growth hormone. So then you get your products like CJC ipamorelin. Another similar product is like Somorelin with glycine. That's a little bit of the older version of our CJC ipamorelin. There's actually Tesamorelin. So we're all kind of splitting hairs between these products, and that's where a provider, with their clinical experience will make decisions on which one to use in certain scenarios, but they're all, for this discussion, I think for the patient listening, or maybe even the provider who hasn't prescribed peptides before, they're really all quite similar. And so again, that growth hormone release that we get with that amplified growth hormone levels, what that does is it causes an increased fat burning. It causes improved sleep. It causes your stress levels to go down, mental clarity to improve. It causes muscle mass to go up, because growth hormone itself is an amazing hormone, and in what it does for us. And again, growth hormone, just like hormones, just like a lot of these peptides, does decrease with age for most of us. Very rarely do I check growth hormone levels on patients over 40, and it's actually very good. And so those are probably the main ones that we use for muscle. With some of the rule changes with FDA, some of the ones that we used to use are a little bit harder to get a hold of these days. But another one that we've recently been able to start using again is called 5-amino-1-MQ. The nice thing about 5-amino, it's actually one of my favorites as well. But 5-amino-1-MQ happens to be oral, so that's kind of nice. Some patients that may get a little fidgety with injectable peptides, it's oral. It actually kind of works through causing the body to make more NAD. And so with that NAD increase, you basically mitochondrial improvement, the power plant of the cell improves, which increases athletic performance for most. What's kind of weird about 5-amino-1-MQ, CJ Cipomarella, and I really haven't had very many instances where patients didn't respond to it if they really truly used it with a good diet and exercise program. 5-amino-1-MQ is one of those peptides that it either is like the most amazing peptide a patient has ever taken, or they're like, I don't know if it really helps me a whole lot, doc. And so it's kind of a boom or bust kind of a peptide. I'm not really sure why that is. I've talked to other providers. They kind of see the same thing. For me, it was a boom, an amazing product, but it was one of those that we weren't able to use for about 6 months, but now fortunately we are able to prescribe it again.
And it's, for me, I think it was fascinating to learn that this tells your pituitary gland to make more of this. It's not necessarily a supplement, but it's communicating to that gland, hey, it's okay to produce more of this, correct?
Right. Yeah. It's actually causing the pituitary. So as we get older, I like to always go back to the squirrel and its acorns. The pituitary gland, stores away its acorns, and it gets very stingy with releasing them. It's, I always joke, but I feel like our body's always back still in caveman days. It's waiting for that big event, and it needs all these things stored so that if the dinosaur comes around the corner, we can, hit the jet fuel button and off we go. And so as we get older, the pituitary gland gets a little sluggish on releasing these things, growth hormone per se. And so that's what it's doing. So you're not giving yourself exogenous growth hormone. You're giving yourself a amino acid combination that is causing your pituitary gland to produce more and release more of that stored growth hormone. And again, like, if it was a skilled provider in peptides, we can debate which peptide is, okay. It's kind of like shades of blue. We can discuss which one is better and which one's better for this patient. But for this sake, I think it's just important to know that there are ways to really improve that growth hormone production and release in our body and really get significant safe effects. That's the one thing I like to always repeat, is the safety of peptides. Again, we have over 7,000 peptides in our body as it is. And they're just, in my opinion, and I think any physician that does what I do, they're so much safer than the majority of things that we've prescribed in our careers. And it's not that those medicines are bad. It's just I simply don't have, like I say, I've not had any severe adverse effects from these products. And it's really nice to know that I can prescribe something that is trying to truly heal the body from within, that has very low side effects, that is just going to simply work. My patients that buy into peptides, they buy fully in. And the great thing is there's getting more and more doctors across the country doing this. And it's really, like I've told you, I really think in 5 to 7 years, you're going to start hearing peptide radio commercials, as now we hear testosterone replacement commercials every commercial break on terrestrial radio.
So if it's an amino acid combination, what's the difference in between these peptides that you're able to prescribe and the bottle of amino acids that I can buy at the health food store?
It's just simply the amino acid. So it's just sequenced. Okay, so the sequence that they're in and how they're bonded. And so, I can just simply go out and get, a tub of an amino acid, like the most common one, the branch chain amino acids that we take to basically, with the different amino acids, leucine, isoleucine, and those peptides, amino acids, to simply give the muscle the ingredients that it needs to produce more muscle. Okay. And that's good. You need to do those things. Whereas if they're actually bonded together in a chain, kind of think of it like chain links. Mm-hmm. So if you just have a bucket full of chain links, that's not a chain. Whereas if you actually buy a chain from Home Depot that's actually bonded together, well, that's a much stronger product whenever you actually link them together. So I guess that would be the easiest way I would say, pure just amino acids are just a tub of links, whereas a peptide is bonded together. And so it's amazing. This is the part that always gets me, is like, you can take, like, let's say you have a peptide that's 23 of bonded amino acids. You can literally take one out and it changes the whole way the peptide works. And so that's why it's a pretty amazing thing. You would think, oh, okay, pull one out and everything's good. And that's why, like, whenever the FDA changed some of these rules and said that you couldn't have, certain a number of amino acids, you couldn't go over that. And that's why some of these peptides today we can't easily get a hold of, because you can't just, okay, it used to be 45, we got to get under 43. You can't just take away 2 amino acids and the product works the same. It'd be kind of the equivalent of, here's your car and take out the distributor cap or something. The car doesn't run anymore. And so that's just always been an amazing concept to me.
So they take that chain link, they put them in a particular order that goes into the body. It becomes a communication message to that part of the body to produce more of a peptide that is positive for certain
cellular functions and that sort of thing. Yeah. Like they can work on the mitochondria, depending on the sequence, maybe it goes to the mitochondria and it just simply has it produce more NAD, more ATP, which you get the effect of that. That's kind of, or we can give going back to like very first step, you can give TA1, which is, made in our thymus gland, that is, trying to improve the immune system and working with the immune system. That's, again, goes back to that theory of, we're trying to just improve those functions in the body of functions that are getting delayed, or they're getting depressed, suppressed as we get older. That's exactly what we're trying to do with these different peptides. And that's also why, as I learn more and more, I think it's more important to cycle these in and out, work on this function for a bit, because the truth is some of these peptides can be expensive. Mm-hmm. That's the one thing, if there's a negative that we're going to say, is that they, depending on a person's budget, they can be expensive. The good news is costs are coming down. They're getting better. We're able to do more for the dollar for our patients. But that's why I'm like, your average client probably can't afford 4 to 6 peptides a month. So that's why you're like, okay, I try to get all of my patients to at least do 2 peptides generally. And then, okay, well, let's do this for 3 months. Let's really work on this function. And then my theory is, if we can really amplify that function up, it's going to self-sustain for a bit once we pull away from it. The battery won't go dry overnight, and then we can go work on another function for a month or two, amplify that up, and then just keep rotating these things and come up with some really cool different protocols for patients so that they can do quite well, again, depending on the goal of the patient.
So every physician has prescribed, and well, probably yet
most of them, yes,
have prescribed insulin, and what we're familiar with that, but we don't. If you asked me, Steve, is insulin a peptide, I would have said, I don't know. But now I do know that we're very familiar with it. These things have been around. So I think of peptides as basically a Morse code that communicates to some portion of the body to start producing more of this that you used to when you were young.
True. Yeah. That was, I have to be honest with you. I didn't even think of insulin as a peptide. I'd never really thought of it that way until got into this. It was like, oh yeah, the most common peptide is insulin. Like, oh crap. Yeah, that is true. Okay. Yeah. And so, and again, we all understand that insulin is something that we have in our body naturally. That's what a type 1 diabetic lacks, is the ability to make their own insulin. And that's why we have to give them insulin back so that they can break down sugar and live, basically. And so, yeah, again, I say it all the time, but over 7,000 naturally occurring peptides within our body, probably a whole lot more than that. That's just kind of what we know. And again, it's going back to a more natural approach for our patients to augment. As I always tell my patients, I'm not trying to get away from traditional medicine. I still prescribe lots of traditional medications, lots of traditional routes of treating things. This is just, in my opinion, a nice augmentation of those things. Sometimes we can prevent these issues, maybe don't need quite as many prescription meds. Not all of my patients take peptides. Like I tell my providers, I'm able to help a lot of my patients simply with diet, exercise, and hormonal balance. But for those patients that have conditions maybe that are a little bit more outside the box, or conditions that they would like to address that the hormones, exercise, and diet aren't seeming to help, peptides are a great option for most of those occasions.
So the folks that are listening here, they're interested in controlling their aging process, taking more, being more proactive over it. What are some of the new peptides that are coming out that are even over the counter that might complement some of the things that we want to pay attention to?
Well, so the BPC again is definitely top 3 of one of my favorite peptides. And BPC 157, as we've discussed, is made in the stomach. It has a tremendous effect on the GI system, the brain, and the musculoskeletal system for aches, pains, healing. I tell my patients that I believe that BPC has a very much of an anti-inflammatory, like non-steroidal anti-inflammatory effect without all the bad side effects. It doesn't hurt the stomach. It helps the stomach. It does not have a negative impact on the kidneys like ibuprofen and naproxen, Aleve can. And so that has recently gone over the counter in the last couple of months. Serene, which is DHHB, amazing peptide that has a tremendous effect on anxiety and just overall nervousness and stress. I really had good effect with that one. Many people call that, the slang term for that one's the chill pill, or Serene. It has a couple different names. In our office, it's called Serene. And that's a naturally occurring peptide that works really, really well for those conditions. And then just in the last week, we've had, and I think we're going to discuss this a little bit more in future episode, but some of the peptides for the skin and for hair restoration. And so we now have a couple different products to who the main ingredient is GHKCU, which is a tremendous wound healer. And it really does a good job, especially in the combination with the arginine and lufazole into improving collagen. It actually can improve collagen by about 70%, the strength of collagen, and decreases wrinkles by about 30%. So that's a cool that's gone over the counter recently. And then the GHKU serum for the scalp for hair growth. And then there's another one called PTD DBM, which is got some really cool things that we can discuss at some point for hair growth. There's some different scenarios where you use each of those for hair growth. But again, every one of those we just discussed were prescription only 3 months ago. And so now some of these as of last week are just now going over the counter. And I'm sure there's going to be a few more to come.
So that's interesting. Several things come to my mind. All right, I'm challenged as far as the hair growth area.
Yes, sir.
So when hair restoration comes into the conversation, I immediately dismiss that would be applicable to my situation. Is that true, or does someone that maybe is just beginning to bald, is this a better situation?
So I had this exact conversation with the patient about an hour ago. And obviously, the worse the balding is, the harder it is to reverse. I always joke, but it's the same exact thing I tell my erectile dysfunction guys. I'd much rather you come see me whenever we're just starting to have an issue than when it's full blown, because it's harder to reverse anything. It's like everything in life. The further we are down the path, the harder it is to fix. And so, it's not that we can't help, guys like yourself, but who we're really going after are the guys that have the bald spot, who are seeing the receding hairlines. We're really going after the women, though, the ladies who are starting to see hair thinning. Like I always tell guys who lose their hair, most of the time we say we look more mature, or we can wear a cap. Ladies, they just, it just impacts them so harshly, in society, self-image. And so we now have, and we were having great success when these products were prescription only. We're just so excited now that patients don't even have to see me if they want to try these products. They can literally buy these products, start using them themselves. They've been proven to be safe. That's why they're over the counter now. So it's just some really cool stuff that's happening with the over the counter peptide aspect of our business.
The one that GHKCU, is this a topical, or is this
So GHKCU can be injectable, topical. Unfortunately, right now, I don't know of any pharmacy that actually produces the GHKCU injectable. It actually has a lot of great effects that we won't go into, since the providers can't actually get a hold of it right now. But we are talking about it as topical. The GHKCU product actually I got it right here. It's called Luminate. And so Luminate actually comes in an OptiClick, and you just do 2 clicks, put it on your hand, face, neck. As I tell my patients, the one area that most of us ignore is our neck. Yeah. And it's one of the places we show our age the most. We're real good at sunblocking our face or whatever, but we don't generally take care of our neck. And so we do recommend applying it to the face and neck. And generally, patients within 30 to 60 days will see, again, about a 30 to 40% decrease in the depth of lines and wrinkles, and up to about a 70% increase in the function of their collagen. And so that just gives you that nice, little bit more youthful look. We're not going to take you back 20 years, but if we can take you back 5 to 8 years, I think that's tremendous. And so the nickname of this is Botox in a bottle. But as I tell my patients, you can still do Botox. That's fine. This just augments it. We're not trying to tell our Botox patients they can't do Botox anymore. And then for the hair restoration, that's actually in a liquid form. So it's basically like a dropper. Mm-hmm. And so that is GHKCU in the dropper form. And you just put a few drops on the scalp, rub it in once a day. Very easy to use.
So I imagine people would go online and they start looking where to purchase these. How do we know which one's really a legit product and which one's not, or we should really, what's a way to measure the quality of the product that we're purchasing?
Just making sure you're buying it from a reputable website. So I guess because my phone hears peptide a lot, all of a sudden now on my Facebook feeds, I get all of these peptide places where I can just literally go and buy peptides, most of which are actually prescription only. But, there are places that sell, well, I shouldn't say that way. You can get peptides without prescriptions, but you're getting them from non-reputable websites, and the purity, I guarantee you, is minimal to nothing. And in my opinion, you're running a big risk of hurting yourself, not helping yourself, or a patient that's going to walk around and say peptides don't work. I tried them and they didn't work, and that's because they didn't have the right products. At our practice, we only use the best of the pharmacies, and at the moment, the only company that is making these over-the-counter peptides in pharmaceutical grade is BioT. And so, if they literally don't say, BioT on the label, then I wouldn't trust it, because that's just simply the only company out there at the moment that is making pharmaceutical grade over-the-counter peptides.
All right. And so many physicians can apply to be a distributor of these. And obviously, folks can reach out to you for these as well, correct?
Correct. And the good news is BioT's has a pilot program that we're in starting December 1st, where they're actually going to start up an e-store finally. And so patients will start to be able to buy that right off the website. Unfortunately, right now, just because of the way it works, they have to just call us. I have patients out of the state that are calling us, and we just, we charge them and we ship to them. That's perfectly fine and legal. But it'll be nice very, very soon that we'll be able to they can go to our website in the next month and just click on it, purchase it, and it'll ship directly to them. That'll be a really nice feature once we have that up and running.
Yeah, so these would be things that you can ask your provider to check into with BioT, or reach out to Dr. Kris and learn how they can start to offer these to their patients as well. And of course, you can always reach out to Dr. Kris. What else do you want to leave us with today, Dr. Kris?
I think we've covered it all. I just, we're approaching the holidays, and I think it's going to be a very weird holiday season. I think we can all agree it's going to be a weird New Year. It's going to be a weird January. Who knows what's going to happen there? But I just think that, it's a really good time. I know New Year's resolutions are kind of overdone, and typically we underperform on those. But I think that in the time we're in, and with the most of us are probably going to have a very different holiday experience than we're used to. That, all the holiday parties and things, I think most of those are probably not going to happen this year. And so it's most of the time the holidays leads to us, in my opinion, kind of setting our health back a few months because of holiday parties and overindulging and those things. I think this is a unique opportunity that we can use the holiday season to actually get ourselves in better health. We're not going to most of us aren't going to have those holiday parties. We're probably going to have more limited get-togethers. Well, let's at least let's use COVID for a positive. Let's concentrate on our health. Let's get active. Let's get healthy. Have fun. Eat all you want on Thanksgiving and Christmas Day, but the rest of the time, let's really try to push forward and stay healthy, and push in the new year, hopefully better than we left the last one. And so that's just kind of one of my thoughts I've been having lately for myself, actually.
Excellent. So next week, I want to ask a lot more questions about these new over-the-counter products and what else might be on the horizon. So thanks so much for your time today, Dr. Kris. This has been excellent. And I encourage everybody to like and to follow. If you got some questions, send them in, and we'll make sure to get them on the agenda. So, Dr. Kris, we'll see you again next week.
Thanks, Steve. Appreciate your time.
All right. And that's a wrap.